Yes, okay. And I will switch here. So for those who do not know, I am Leonardo. I am from Italy and Venezuela. It's a very long story, but I am a diving doctor specialized in high pressure medicine and undersea medicine in Barcelona, in Spain. And I have few credentials to perform my work. I have 24 years of experience in diving and 8 as a doctor and specialist in diving medicine. So I have dedicated my life to treat divers in after accident. Some of my specialties and what I have dedicated my life is to clinical hyperbaric medical assistance. I am also an air ambulance physician or doctor. I am specialized also in high pressure systems and the technical part of the equipment itself. And as a diver, I have few other credentials. I am a 3-mix deep diving instructor in diving. I am a hyperbaric chamber operator instructor also. High altitude diving, technical side mount. These are some credentials of me as a diving instructor. And I am a rebreather diver and full cave diver also. So I have some experience about what we are going to talk today. My colleague Joffre, you want to present yourself?
Yeah, sure. Hello, everybody. My name is, you can see there is Joffre Guzman-Laguna. I am also a medical doctor from Colombia. Although Leonardo is further along his career than I am what's understood as a general physician or a general practitioner. And among the many credentials that I also have to my name, the most relevant is that I'm also new to be certified as a hyperbaric chamber operator and also as a hyperbaric chamber tender, as well as I've also had clinical experience in the Central Military Hospital in Bogota, especially dedicated to the management of what's the word?
Surgery, critical care.
Yeah, surgery, critical care, but specifically for martial institutions. So
military operations injuries.
And you can see our physicians we're very restless lot, so we do a lot of things.
So a little introduction of the department, which is in Salisbury, Landspítalanum. We are open 24/7 for diving emergencies. We have different channels to contact us. We are going to cover during the meeting today. We have diving doctors always on call. There is at least one diving doctor in Iceland on call, and we take Iceland, Greenland, and Faroe Islands. So all the North Atlantic related to diving emergencies, they go to us. We have nurses also in our team on call, which are specialized in emergency department nurses and intensive care, Nanna, for example. And we have, of course, our team goes administration persons, technicians, and it's bigger. But we are always on call, at least one diver plus the rest of the team needed to attend a diving emergency. We have a multi-place hyperbaric chamber for 8 persons maximum. So it's quite tight, but we can fit up to 10 persons if we need. We can go maximum of 55 meters deep in the chamber. And we can put 1 bed plus 2 seating in case of an emergency or intensive care. Let's say 1 bed would be 1 patient in intensive care. So we have capability of full intensive care management inside of the pressure chamber, as well as minor surgical procedures. We have plenty gases on stock to make all the treatment tables that they are available worldwide. We can do all the treatment tables from the US Navy, from the Norwegian tables, from Comex in France, from Australia, and we have nitrox, oxygen, and heliox on stock for the worst case scenario on the treatment. We are going to talk a little bit about this later. Normally, we do treatments to other patients of the hospital, not related to diving emergencies. So we are open from 8 to 2 every day, from Monday to Friday. But the rest, we are 24 hours for diving emergencies. And through 112 or the Brada Motaka, you can find us 24 hours.
Alrighty, so the presentation, or say the agenda that we have for today's presentation is the following. We're gonna go through a scenario that Leo briefly teased for us, and after that we're gonna say review that scenario. We're gonna go through a couple points to discuss and try to pinpoint what things that could have been done better about how that particular problem was solved. After that, we'll go into a little bit of a theoretical review on how do we know when we're running into a diving emergency and what to do when we know that we're actually in the face of a diving emergency. And after that, we'll just have a quick takeaways. And here's just some learning objectives, just to understand, to quickly recognize diving accident as soon as it happens, specifically the ones that require emergent care or emergency care, and to understand what to do, not just how to recognize, but we need to know what to do and when we're facing a diving emergency, and also to understand the lines of communication that are open, which is the first point that we would like to start driving home, which is that there's always someone or something available for a diver or a group of divers in case of an emergency.
So what do we want today from this meeting? 3 things. The first thing is to know when do we have a diving accident? What is a diving accident, or am I having a diving accident or not? Second, what do I have to do if I have the diving accident? And third, how do I contact the correct person if I have a diving accident? So this is the 3 things I want you to keep or to take with you today from the meeting. The scenario, as I explained, is a text from the diver, and he cannot be here today because he's working, but I would like one of you volunteer to read loud for us. Any volunteers?
Ég enn með smá verk í vinstri öxl og örlítinn boða vinstra megin í andliti. Do you want me to read this in English?
No, Icelandic. Are you ready?
Okay, I'm starting again. Ég enn með smá verk í vinstri öxl og örlítinn boða vinstra megin í andliti, niður með hálsi og hnakka. Hélt að ég, sem reyndur kafari, gæti ekki lent í svona atviki. Hugsa á leiðinni í land, hvort ég ætti að nota súrefni, en nei, þá fær einhver að spyrja hvað gerðist. Ég skammaðist mig. Fyrstu einkennin komu fram 3 klukkustundum eftir að hafa skotist upp af 35 metrum eftir margar kafanir þá helgina. Þegar ég keyrði yfir Öxnadalsheiði kom fyrst fram verkur í vinstri öxlina. Enn var stoltið fyrirferðarmeira og ég hugsaði, líkaminn sér þetta. Svo á mánudag byrjar að mynda stofi í andliti og hann ágerist á þriðjudaginn. Í samtali við góðan félaga það kvöld nefni ég í hálfkæringi að ég sé enn með verk í vinstri öxl og við það kvikna öll viðvörunarljós hjá honum. Hann hvetur mig til að hafa strax samband við köfunarlækni og eins og fyrr í daginn hugsa ég, já, ég heyri þeim á morgun. Ég fer ekki að trufla á svona seint. Þegar ég svo í hátíðina á miðvikudaginn kom að bráðadeild Landspítalans og hitti Leonardo og Joffre verða mér ljóst að þeir vissu strax hvað var í gangi og að ég hafði brugðist rangt við. Eftir fyrstu meðferðina í afþrýstiklefanum gerði ég mig grein fyrir hversu alvarleg kafaraveiki getur orðið. Til dæmis stofnaði öll húðin og ég hefði getað klipið mig til blóðs án þess að finna neitt. Svo var ég líka með verki sem hafa þó lagast mikið. Kafaraveiki getur í sumum tilvikum leitt til varanleg skaða og þarf því að taka alvarlega.
Okay.
Í þessu ferli áttaði mig á því hversu mikilli faglegri þekkingu, tileinkun og tækjum köfunardeild Landspítalans búin og hvernig mörg okkar vitum ekki nægilega hlutverk hennar. Til að mynda að okkur alltaf velkomið að hafa samband í okkur daglegu áhugaköfun ef við höfum áhyggjur eftir að hafa kafað út fyrir töflurnar eða lent í einhverju sem gæti leitt í köfunarveiki eða einfaldlega til að leita upplýsingar. Eftir á hef ég leitt hugann að því hvað hefur verið orsökin, hver voru viðbrögð mín og með kafara og hver fyrstu viðbrögð hefðu átt að vera.
So, after this event, these are some questions that we get. We think about what happened and what can we do better. Should the discussion or the planning before of the dive have been more open and clear? So I think a pre-dive briefing is key for safety in every operation. It doesn't matter if you're diving silver, if you're just going 30 meters to do some light work under the water. A pre-dive briefing with all your dive buddy or your friends is key for every procedure. We have one we do in the chamber every time we are going to do a deep dive in the chamber, and we have a safety plan. We have a briefing. This is my role. If something happens, I know already what I have to do. He already knows what he has to do, and he already knows what is his position. So this is very important in the safety of the dive. Also, because if something goes out of this plan, then we know that something is happening. And this is not correct. Why are we going out of the original plan? Another thing is that when we are deep, we have narcosis, and it's very likely to change the dive plan under the water. And this is number one, to have a diving accident. If we are changing the dive plan under the water, this is for sure a diving emergency after. It's okay to change a few things, but you cannot say, oh, the dive plan is 10 minutes, I'm going to be half an hour. It's a big difference in time. So this is very important. And if you are going to do a work under the water, or if you're planning a dive, and there is not a good briefing, for me, this is a reason I'm not diving with these persons, because I cannot rely on my dive buddy. Do you agree with me?
Yes.
Why did I dive outside? Yes, of course.
If you deviate from the dive plan, what do you mean by that? You did mention you are extending the diving time. Okay, and I understand that.
Yes.
But if you decide to go to the left instead of going to the right, dive elsewhere.
Yes, yes.
Because the visibility goes for it.
Yes.
But you maintain the same depth profile and the same time, then really you're not changing your.
No, but in the dive briefing, this is the scenarios that we have to cover. Okay, what happens if we get lost, if we don't find? Okay, I know my plan is maybe I keep swimming for 2 minutes, and if I don't find my dive buddy, I go to the surface following my safety stop. This can be one response for one situation I can have under the water. Okay, what happens if we have a strong drift at 10 meters? Okay, we cancel the dive, we go up, and we find the dive buddy and we go to the shore. What happens if we have a descending drift? The drift is pushing us deeper and deeper. Then we have to swim or else, and we have to create one plan for each situation that we can think it can go wrong in this dive. Let's say we are diving Silva. We already know there are some caves, very deep dive, somewhere in Silva. What happens if you're diving in Silva and your dive buddy decides to go alone in the cave? You need to know how to answer this. You cannot just go swimming behind them, because maybe there is 2 persons to rescue instead of 1. So this is what I call by a good briefing. Think what can go wrong and make a plan for it before the dive. Of course, there are millions of possibilities of things that can go wrong, but the most that you have, the more secure or the more near to the safety dive you are. So this would be my recommendation. You can have also a secondary plan. Okay, what happens if I am under the water and I need to be 5 more minutes? Then you can have a second plan for this situation. Oh, if I need to go 5 more minutes, then I need to do a longer stop. And you do a longer stop, so you know that you have a 5 minutes deviate from your original plan. So this would be my suggestion, but it's open to. What do you think? Yeah, it makes sense. And the dives on recreational diving, you don't have to create these for every single dive. You can just have it, and if it's an agreement between friends, you already know it. Okay, if we lost ourselves because the visibility is very bad, we just go to the surface after 2 minutes. Then you already know this. Okay. A little bit of common sense also to put it. But the thing is that diving is fun. We are just making laugh, and we go and we just take our equipment and we assume that the other one knows or thinks what I'm going to think under the water. Then is where the mistakes are coming. Why did I dive outside what have been planned? So, as I told you, we can be flexible in some things, but we should have a secondary plan for going out of the original plan. So, if you are forced to do something or you are doing something is out of the plan, this would be a call. Let's go to the surface. Let's plan this for another dive. Let's do a surface interval. Let's prepare the equipment again. Let's do another planning, and then we do the dive. This is how I would have done this. Let's say we need to, I don't know, fix a thing, or maybe you are taking photographs of under the water and you saw something very interesting and you want to keep more time, then go to the surface, change your tank, plan again, look your surface interval, and go down and take more pictures. What in my mentality and that of my body's cost that I did not talk about the incident, and this is very important. When we have a diving incident, there are two scenarios. I am diving with my friends, so I am ashamed of telling him that I have an incident, because then maybe they don't want to dive with me anymore, because maybe I am ruining the plan of the weekend, because maybe we drove to the north and we have to come back, so I'm like the bad person on the group. So it's a lot of this when we have a diving incident. And the second part is when we are talking about a dive operator, or if you're working as an instructor, because sometimes you can have a diving accident in your students, but you're afraid to say it because, oh, maybe I don't have clients, or they're going to question my safety, or they're going to question if I am doing things right. This is what we have to cut today. We cannot allow this, because it's our own safety. And I think in Iceland there is a very united group, and we are, it's like I can see you all and you're like a diving family in Iceland. So we have to cut this, and we should not have or think that a diving accident is something bad. This is something that can happen to anyone. And this is why we are here, and we need to support each other when this happens. What should have been my first response? We are going to answer this later with all the work we have done in the last week for you. How can we ensure access and use of oxygen after a suspected incident? And this is another, I'm going to close my presentation with the oxygen kits, because I know there is some problems with the oxygen supply in Iceland for the divers. So we are going to, this is something we're going to talk about this later. Do you have your own oxygen kits, or how do you manage this?
The club is renting like a large case of oxygen, and we pay a fixed fee every year to have it.
Okay.
And we take it every single time we go on a trip. If it's north, east, west.
Okay.
It's always someone with it.
Yeah, but we just take it on a trip. We don't take it when it's like close to here. No, it doesn't go on Óttastöðum.
Let's say we go to Dalsgjá.
No.
Okay.
But there are kids there, and there are always operators, dive operators,
Okay.
that have their own kids. We know that.
Okay.
Not where we go in Dalsgjá. There's nobody there, but it's close by.
Okay.
We take the kid with us when we go to dive expeditions that are in the name of the club.
Okay.
But not if we are 8 or 15 divers going to Óttastöðum.
Okay.
There is no kit.
All right.
Okay, that's close by. It's in the Reykjavik area, but even so, it would be maybe something we should talk about.
Okay. Yeah. We can talk about this in the presentation. Is it a Dan kit, if I may ask, or Linde?
It's just an oxygen bottle with
Supply from Linde,
supply
I guess.
from-
Oh, okay.
Yeah. It's constantly flowing, so
Yeah. Okay. Perfect.
you can manage the flow.
Mm-hmm. Yeah. Perfect.
So now that we've reviewed all, we're going to put some pause on that, and then we'll retake that as Dale was mentioned further along the presentation. But now let's review. How do we know we're actually dealing with a diving emergency or a diving accident or incident? It's named different things throughout the literature. We have come up with this rule of thumb, which is overall you should come out of the water as you went in. The same person that went in has to be the same person that comes out. What I mean by that is that if you had anything or did not have anything before you went in the water, you shouldn't have anything when you come in. If you do, then that immediately has to set up some alarms. Next to this, can you go back? Next to this rule of thumb, we put this little asterisk. So hold that in your mind for now, because that's going to be like a little caveat to this statement. But overall, the idea that I want you to take with you is the one who comes in has to be the one that comes out. If not, something has to be going on. Next important idea. I understand that signs and symptoms in Icelandic are put in the same word, but in the rest of the English literature and also the literature in the Romance languages, they are divided into two categories.
We actually have two terms, but the others are rarely used. It's
Oh, I see.
For signs in the medical literature, but it's
not
used.
rarely used. Yeah, but we thought that. Thank you so much for that. But we thought that it was actually important to clarify, just to be sure, and it actually gives us another important idea. A sign, just to leave all the physical examination textbooks to the side and just give us something that is fact. A sign is something that we look at and we say, okay, this doesn't look right, this looks wrong. So this is from the perspective of the diving body, say, looking at the other person. A symptom is, I don't feel good. This doesn't feel right. Then there's the two things, the responsibility of the diving partner and also of the individual diver. This is what actually I feel like right after I come out of the water. Something doesn't feel right, I don't feel good, I have aches, I have pains that I didn't have, something's going wrong. Okay, so now, before we jump into the severe signs and symptoms, the ones that we actually have to look up because they require immediate action, key idea about the pathophysiology of decompression sickness. Not to make it too complicated, essentially what we know is that there are bubbles that are formed within the tissues from all the inert gases that have dissolved into them. Right? So what bubbles do, gases do, they usually aggregate into larger and larger fluids. So that's an adhesive property that fluids have. So the dangerous thing about these bubbles is that they will take the shape of the container, and that container could be an artery, it could be a vein, but it's even more dangerous if it's an artery, because then when that happens, it compromises the irrigation of what's understood as the flow of oxygen into the tissues that depend on that artery. You guys follow me? So if, say, for example, one of the arteries in the brain becomes compromised by a bubble, then guess what happens? It's a stroke. It's an ischemic stroke. If, God forbid, one of the arteries in the heart, one of the coronaries, what happens? That's a heart attack. Now, the same principle applies to all the same to the rest of the signs and symptoms that we will look at.
May I add something to you?
Yeah.
Diving and all the diving medicine is a science that is not 100% developed, talking 2022. So there are some things that are not known for us as a doctors, and it's very unlikely to predict how is it going to come for me, the diving emergency. There are multiple ways it can go. And as my colleague was explaining, these bubbles, they can form anywhere in any tissue of the body. And this will be different depending on the size, on the weight of the person, the type of the dive, if he was drinking beer or water the day before. There are multiple factors that can change this. And depend on where these bubbles will appear, then we will have signs or symptoms that are different. So if I'm having the bubbles in the head or in the brain, I will have a patient that I can confuse as bleeding in the brain, for example. But if the bubbles are in the heart, then it's going to look like a heart attack. If the bubbles are in the spinal cord, it's a person which will have neurological problems. So this is why we say that anything that is not normal after a dive, it have to be looked by us.
It could be, and we'll see this right now. So we'll go. The best way to recognize when something is going wrong, to make it very practical, we go from head to toe. It's a cephalocaudal approach. That's the approach that those physicians take for physical examination, but it comes very practically for diving emergency. So the first thing is, well, obviously, if someone's coming out of the water unconscious, something is definitely going wrong, right? But we can also have something that might not look as ominous, which is somnolence or feeling sleepy, right, coming out of the water. It could be easily dismissed as, hey, you're just tired, it was a long dive, we did a lot of stuff down there, you're probably tired, you didn't sleep enough. If it's happening right after the weather, and it should be setting off some alarms. Convulsions, obviously, or what's also called seizures, are also alarming. Dizziness, understood as the sensation of vertigo, or some of you probably have had vertigo in the past, or it's like the sensation of the room spinning around you when you're standing still. And extreme fatigue could also be with somnolence confused as like, hey, that was probably the dive, you can slip it off. Probably not a good idea. Okay, so coming down from the head to the face, what could be broadly described as either vision or speech impairment. I have a personal anecdote. What my father debuted with his first, what can be understood as a pre-ischemic cerebrovascular incident by just having a speech difficulty. Everything else was fine, but he just started like talking and mumbling where he couldn't like actually articulate his words. Everything else was fine, but that was the key finding that point. Hey, we need to get to the hospital now. So that being receptive to those sorts of things could also be life-changing and life-saving. A more, say, what would you call it, a Hollywood-esque, or more something that you would see in movies is the bloody or the frothy mouth. It could also be misunderstood as something that has to do with convulsions or seizures, but it could also happen in severe or very aggressive cardiovascular incidents. Say a cardiac arrest that actually occurs with acute heart failure could have that. So let's be attentive to such a thing. Going down from that to the chest, we decided to only put here respiratory symptoms, so difficulty breathing, or what's also called dyspnea, or a severe cough. There's a cough that just doesn't go away after we put everything away, and say it's been 10, 20, and even 30 minutes after we've left the water. That should set off some alarms as well. And what Leo was briefly mentioning, what it has to do with the symptoms that have to do with the spinal cord, etc., but also with the brain are directed or could be identified in the limbs. So either the upper or the lower limbs. First thing, pain, just unbearable pain. So from very mild to unbearable pain in the joints. Usually that's a dead giveaway to some of you that have already had or have experienced decompression sickness. That's one of the most common symptoms. But also paralysis or weakness of the limbs. It's, again, very similar to a stroke. You have seen probably the what's it called, the caricature of a patient that has a stroke, that they immediately go limp on one side of the body, that they're dragging their leg, or they can't lift their arm. That can also happen. But, and this was the case of the patient that we were discussing, it could be something as tame as just slight numbness or tingling. Or it's like, hey, I feel like my hand, like my palm is falling asleep, or like the side of my arm feels funny. And did you go diving? They're like, yeah, I actually went diving, and it happened right after. That could be very much the
something that we should not delay is to wait for this to be very severe to get help or to activate the emergency plan that we are going to present after. Because we can start with a little bit of pain, but if it's not treated, it's going to be very severe. And then the more we delay the treatment, the less we can do for you in the chamber. It's going to have the less results in the effects of the pressure in the chamber. So as soon as possible is the better outcome for you guys.
Right. Now, those are the severe symptoms. Now, let's talk about what are the milder symptoms. And they're mostly cutaneous, or they have to do with the skin, and specifically what's called cutis marmorata. It appears as a discoloration of the skin that looks marbled. It's understood like this. You can see, let's see if I'm giving everyone a chance to look. Usually looks something like this. There are patches that look a little bit like almost like continents or countries. That's a really good way of describing them. But the key thing is that they look reddish. It's a reddish or bluish discoloration of the skin. How do we know that? Well, usually when we come out of the water, taking off all of our gear, it's very good to have a good look at ourselves and a good look at each other. One patient that we had actually had cutis marmorata, this very same finding, but in the back of his thighs. So it's like he didn't even know. No one that brought him knew when we were doing the physical examination before we took him to the chamber. It's like you actually have those little patches behind your thighs. So yeah, and also along with the mild symptoms, a sensation of general, not malaise, but some sort of fatigue or feeling tired. That could also be, with everything else being normal, that could be something significant. I don't know if you would like to mention this one there.
And these are some situations that are likelihood of a diving emergency, but maybe we do not have any pain or any sensation at all, but it's definitely something that we have to take care about, and we have plans for this. So omitted
this is the remind you the little asterisk that I brought you guys.
Okay.
I said you go in the same, you come out the same, but if these things happen, then that's when we have that little exception. Sorry.
So omitted the compression stop. I am doing a very deep and very long dive, and I have some planned stops, and I missed this, and I went to the surface. Okay, maybe I reached to the surface in my same condition, no pain or no nothing, but hey, something went out of the dive plan, and we have to look into this, and we have something to do with this. Buoyant ascent to the surface, breath holding during the ascent, breathing contaminated gas, which I think is very rare here in Iceland. There are a very good system of productions of air, but it's important to know, and equipment malfunction during diving. So these are some scenarios. They went to my head, but there may be some others you can add to them, that you can go to the surface feeling well, but okay, we have to look into this. Do we need to do some preventive treatment in the chamber? And actually, we have some plans for this type of emergency. Let's say I went like a boy to the surface. Okay, we have a special treatment for this in the chamber to avoid any complication after. So this is important for you to know this.
Something?
Yes.
You definitely don't need to have any of these. Just a reminder. You can't be diving like a normal, perfectly fine profile and still have stuff happen. I've seen that, and like, I got like skin bends one time.
Yes.
And even after the dive, it was perfectly fine. Like I had no idea anything had happened, but it was only like some hours later that the discoloration started to appear in the middle of the night and got really itchy. And then I looked down and saw basically what you had earlier. So yeah, so even if everything is within boundaries, and it can still happen. So
this is a perfect example when I mentioned that it's not an exact science. The tables, the diving tables, is an approximation of safety, and all the diving tables, they come. Let's say the major creator of diving tables is the U.S. Navy, and they create this based on a Navy SEAL. We are none of us. We are in the physical shape of a Navy SEAL, I can say. So of course they have taken and make it more safe, and they have make it more conservative, but it's a very inexact science. So it can happen, and we have not reason to be ashamed of it, or to talk about it, or to ask for help. And there is no, I want to push this very much today. There is no reason to think that you are going to ruin the trip, or you're going to be the bad guy, or they're not going to invite you anymore to diving. This is something that can happen, and it's important
I tell
to
you what
react to that.
ruins. People die without telling us that they are not feeling well.
Yes.
That ruins a trip.
And also, when there is an accident and nobody reacts, then it's come, oh, I didn't help him, I didn't do this, I didn't do that. So
maybe it's also a little bit issue of trust.
yes,
Because if you don't trust your dive partner,
yes,
you're not going to tell him.
yes.
Because you think he's going to judge you or whatever. But if you trust people, and you know, well, okay, they're probably going to talk about it, but that's okay. And you have to be able to trust people that they are bearing your interest in mind. And
Yes, I totally agree. I think it's a similar situation is when we prepare to dive and one of the divers cancel the dive. I don't want to dive. There is some rules in diving. Do you know them? You can cancel the dive anytime, any moment, by any reason, without giving any explanation. Am I correct?
Yes.
I could practice this during the weekend. We got plenty of diving equipment because we were going to dive few places around Iceland in one weekend, and we got tanks from Siga, from Landspítalanum, and from everywhere. We had the car full of tanks. Did we dive? Not one single dive. We went to one place. Okay, the weather is not okay. We went to the other one. I am tired. Then, oh, you are tired now. Okay, we didn't dive. We did hiking. This is okay.
Yeah. And it's good to bear in mind. There's always going to be another dive.
Yes.
Later.
Yes.
That's right.
And
If you don't do this one, you will do the next or
Yes.
sometime later.
And if you don't dare to tell your partner about it, or your buddy, you can go out, take all the gear, get into the ocean and say, on the way down.
My ears, yeah.
Everybody understands that you can't dive if your ear isn't going.
Yes. Yes.
So go up.
This is a good trick.
I'm an instructor.
Yes.
There's one thing on the last, you
Here.
talk about omitted decompression stop.
Yes. Here.
This would also apply to a regular safety stop. But
You can add
maybe
it,
to
yes.
a lesser degree, maybe.
A
Because
safety
I know
stop.
There are lots of divers here who do not do decompression stops.
Yes, I know.
as a rule.
Safety stop for me is not a reason to think about an emergency because safety stop is additional. It's not required. We should do it. We should always do it. I want this to make it clear. But if we do not do the safety stop, there is no medical reason to have a disease or a diving emergency. But as I told you, every single table is not an exact science. So the safety stop is this additional safety we can put to our dive. And depend on the conditions. If I was performing a very heavy exercise under the water, maybe I want to double the safety stop in time.
Safety stop is essentially a decompression stop.
Yes, it is called. All the ascent to the surface is a decompression process. So I agree that the term for decompression stop is wrong by itself because every single step of the ascent to the surface is a decompression, but it's like a known slang. But everything out of the plan should be considered, or at least there is a phone number I'm going to share with all of you. It's 24 hours line, and you can call us and, hey, this happened to me. What should I do? And then we can, by phone, yes, you should come to me or come tomorrow. Or let's see how you feel. We are prepared to give this assessment by phone to you. What do we do when we have a diving emergency? So now, until now, we know how to know when we have a diving emergency. So anything that happens after a dive that is not looking good, not feeling good, we should suspect of a diving emergency. What should we do now?
All right. So we took the liberty of putting this algorithm together. It kind of looks a little scary, but we'll walk through it, each one of the steps. Okay. So we always start up here. And the first thing we ask, or the first thing we recognize is there anything wrong? Do we have any signs? Do we have any symptoms? Now, notice this. We can either, yes, have severe symptoms, which are all the ones that we listed in the slide above. We could have, yes, mild symptoms over here, or we could not have any symptoms, but any of the scenarios that Leonardo just described could have happened. Now, we know what we're going to do in each of those scenarios. So first, if we have severe symptoms, any of the things that are here in red, we immediately call 112. Without asking any question, without asking confirmation, it's like, hey, do you think this? No, let's call 112. This doesn't look good. Right? And after that, we keep following the algorithm, but let's pause it here. If we have a mild case or no symptoms, but this scenario, the second thing that we have to ask when we have mild symptoms is, do they become severe at one point? Say, does the person have any manifestations in their skin? and at one point they lose consciousness, so they start feeling sleepy, or they start showing any of the things that are here, that immediately turns it into a severe case, and we have to call 112 without asking any questions, without hesitating, right? So we're right here. Right after we call 112, we have the very nice dispatchers at 112 will tell you everything that they will ask you serious questions, so that they can immediately know where they will send the ambulance, if they have to send an ambulance in the first place, etc. Right after all the instructions have been given by the 112 dispatcher, the operator, we start basic life support. There are some of us here that are actually certified into giving life support. If not, for some reason in the dive group there isn't someone who is
always there is someone who knows first aid.
There usually has to be someone. There should be someone, but if not, then we have to look for someone who does. Right? After that, and this is crucial, Leonardo will continue to hammer this point home. We have to supply oxygen, number one, for the diver, and second, we have to follow these indications right here. We have to keep following the indications that were given by the 112 operator or by the dive physician. We'll come back to this later. We have to protect against hypothermia, so we have to wrap the person in blankets, whatever we have lying around, just to make sure they don't get cold. Very important, also very crucial. We could even put it up here next to supplying with oxygen. We have to keep the person hydrated. What we're trying to do with this is that we're trying to have them absorb as much water as possible, so that if there are any bubbles, it can actually be dissolved in the liquid, right? In the liquid within the arteries and the veins. And we place them in the recovery position, laying on their left side. We all know, right? So that's for severe symptoms. Now, what happens if, say, we have a mild case, just mild symptoms, or one of these scenarios? We immediately call the dive doctor. So either Leo or myself, whomever is on call. This is the number that Leo was talking about. We're available 24/7, just as the chamber. The chamber is always ready to receive anyone who might need it. You call us. We go back and forth with the case, and we tell you like, hey, yeah, actually, you can. It's not that big a deal. Oh, yeah, actually, bring it over. We want to look at it because it's kind of not looking right as spring, and we'll tell you like, hey, that might actually become severe at one point. Let's start the oxygen supply. Sure.
The number for the diving doctor there.
Yes.
Þetta sem sagt bara aðalnúmer á Landspítalanum. Þið fóru samband við skiptiborðið og þið bara segið þeim að þið fóru samband við köfunarlækni. Nú alltaf möguleiki eins og núna þú veist það sumarstarfsfólk. Þá bara segir maður þeim að það er víst að hringja í köfunarlækni allan sólarhringinn þegar að verður slys eða einhver reynir að rökræða. Og þeir gera það. Já, þeir gera það. Já, þú veist það er bara sagt sumarstarfsfólk og svona hluti sem gerast sjálf. Bara eins og það er. En þá bara satt að segja þeim að jú, það eigi að hringja í
I will finish something here.
Og hvað er mamma? Til að vera til. Eða því að venjulega sama hvenær sólarhringsins. Venjulega ekki hringt í lækna áláttunni fyrir sjúklinga en sem sagt fyrir þær ákveðnir sem að gera það bara víst. Það getur verið að þurfa að segja fólki að þetta er víst að vekja lækn. Og það er bara til lækn. Þessi sé, sumarstarfsfólk, það er alltaf getur þetta ít á þessu. Sorry.
No, please.
Búið að valnáttur verið, þeir eru ekki vakt til mig.
Það verður lagað í haust.
Það er lagað. En þeir verða náttúrulega í þessu líka.
Já, þeir eru að vita þetta líka. Þessu nefnir bara að sem sagt segja jú víst.
We have prepared this also, so I will post it in the Facebook page and I will distribute, so you can print and plastify, you can have it in your phone, you can put it in the car, in your dive equipment, wherever you want. And I will resume it in 3 words. Do you need an ambulance? Call 112. Something happened, but you do not need an ambulance? Call the hospital. As simple as this. You want to...
Já, ég get alveg að lesa. Sko, við erum að spyrja náttúrulega alvarlega slys. Þannig að ef við erum drukknum og annað, þá erum við bara með rauðarspurning sem við spyrjum. Og það er langast bara að svara þessu. Við spyrjum ekkert mikið út í köfunareinkennin. En ef það er eitthvað sem að gefa til kynna að þetta sé alvarlegt, þá sendum við sjúkrabíl, við sendum lækni, björgunarsveitir, kafara þarf og þyrlu. Þannig að við erum bara að hugsa allan pakkan. Þannig að það er nokkur enskumann að þérna. If you call 112 and with some of these symptoms or some kind of these incidents, we will most likely dispatch rescue service to you. An ambulance, a helicopter if needed, rescue operators if it's somewhere in big distance or if it's a rescue. So we just ask series of questions about the most serious cases, and we usually take care of the rest. But there's one thing that we do in World War II. Certain kinds of accidents, like a car accident, if one person is injured, everyone inside the car is considered possible injury. It's the same with diving. If the one person inside of the room is filled with smoke, has symptoms, everybody is suspected to be allergic. So we would most likely, the doctor would likely like to contact everybody who was diving at the same time, the same time. Because you should stick to the schedule. So if one gets sick, everybody is affected. This is what I was considering.
Some even got this treatment if they go diving solo.
It's often to practice solo diving in Iceland.
Some do it. Yeah.
Okay. Yeah, I do it also. So this is just
If you got the whole squad on it.
okay.
They saw a person walking into a lake and they called the emergency services.
Oh yeah.
And when he came out with it was like helicopter
Yeah.
waving around.
But we'd rather have that than
Exactly.
Yes, of course. I mean, solo diving is something we can practice if we have the experience and the training to do it and the equipment. Sometimes diving with an unexperienced body is more dangerous than diving alone. So I'm not against that. But do it correctly. This is a short, okay, what do you think about this? Because we made this for you guys this week. We were talking with a doctor who is in charge of all the ambulance doctors in Iceland. And this has pre-approved, but we want your opinion also, because this is for you. And we can change it, we can modify. If you want purple instead of pink, we can do it.
I think we should get one and classify it here.
Yes.
And I like the idea for everyone to keep it in their diving kit.
I think it's very nice.
If you're panicking or if anything happens, it's good to be able to look at it and know exactly what to do.
Perfect.
Yeah.
I will download it in PDF and share through the Facebook group, so you can print it maybe in pocket size and plastify, or a big one for the wall. You can have one in the oxygen kit also.
It's good to always keep stuff. The reason why we made it very similar to the medical algorithms is because they're meant to be carried around wherever you're going. And another thing that I would like to leave you guys with is that don't feel pressure into memorizing all of this, because there is a temptation to like, hey, okay, I actually have to learn it and I have to picture it clearly in my mind. And that doesn't happen. I mean, us physicians, we learn this kind of stuff because we're crazy. But even us, we carry usually very complex algorithms in our laptop, because it's actually more trustworthy of our part to carry it and actually consult it on the go than to actually memorize it and say like, hey, was there an error between here and here? I don't remember. Were we supposed to like do chest compressions first and then call one? You see, so it's better to just like whip it out. Okay, 1, 2, 3, and you're set. So bear that in mind.
I think one excellent thing there is that now you have a program to know, and this is no issue, because that's 4 years since we were in El Grillo. 3 years. I ended in the chamber after that. That was, we had 3 dives during the day, and everything was perfect according to the computer. And then in the evening, I started to have a pain here, and I was not sleeping the whole night. And day after, I decided not to go diving, and ended in, we took the oxygen later that day, and then we drove home the day after. And then I have also into the chest, it was like that. So I ended up in the hospital. My wife thought that I was getting a heart attack. And there were 3 doctors there thinking what the hell they should do with me, and found nothing out. And then they decided to call the diving doctors. And then I ended in the chamber. And I don't know why they did not do that maybe 2-3 hours before. I think they did not know what to do either.
Okay.
They don't remember we exist.
Yeah, I think it's more because she came to me and she said, well, I called them, they are coming in a few minutes and they are coming. I don't know why there are many coming. But of course, one has to be outside the chamber. Control it. But this would be a very good, like doing in a line.
I mean, it was similar to when I had the incident. I called 112 and told them, call the doctors at the hospital.
Yes.
And because it was Saturday, day before Christmas, and I said, you have to call them. They have to get there and be there when I arrive. And I was like instructing them what to do. And I thought, this is crazy.
Okay.
Yeah, I think even in your case, there was no sense of emergency because it had happened 2 days ago. And you were calm and there were no obvious symptoms.
Yeah, I was on my way to the chamber. I was close to a diving accident. I mean, the computer said no. Then I took the computer. The next time I came to the chamber, and he took the number from the computer and took the tables, and he said, yeah, you were diving for too long, according to the tables. So I may be a popular or something like that, condition, cold or whatever it was.
Most of the
He's still alive. He was my partner the whole time.
okay. Most of the diving accidents, in my experience, they start like a very light condition, and then we say, "Oh no, this is nothing, and it's just psychological." And then I drink some beers and I go to sleep, and then the day after the pain is worse, and the more time it passes, the less we can do for you, and the more life sequelae you're going to have in your body after this. So very early, and you do not need to wait to have a very severe pain or be killing yourself in pain to call us. You just can call, hey, I have this, I'm feeling this, and this dive. We are going to ask how deep you were, how much time, how many dives, like the dive profile, because this is the first thing we ask. And then we will tell you, okay, you should come to us, or it's not necessary, it's not a diving accident, this maybe should be something else, go to your nearest heilsugæsla. And this is something we can, by phone, give you some orientation on this. The other thing is that during one of the recent accidents, there was some rumors about, oh, you should call Dan. Do you all know what is Dan, right? Have you heard about it at least? Dan, they have an international number, which is for diving emergencies, and they have also 24/7 diving doctors on call for diving accidents. Dan is they are in Durham. They are in the United States. It's the call center of them, and they speak English, Spanish, many languages. I am the referral doctor for Dan in Iceland. So if you call Dan, they will transfer the call to a doctor who is going to ask millions of questions because it's a line like 112. They have like a procedure in the computer. And then they will say, oh, yes, you have to call this because it's the nearest chamber to you. And then we will get the calls through them. So we can just skip all this and call 112. You have your own Dan number in Iceland. So don't be afraid to use it. We are, every year, we are in the obligation to send Dan our information, and we have to send the information of who is the doctor, like the supervisor doctor of the department, and there's a lot of paperwork we have to do. So our chamber is the referral for all the North Atlantic area for Dan, and I am the doctor referral for the area also. So we are very connected with Dan, and they also have a hotline for doctors. So if I need a second opinion of another doctor, I have a direct line different from that one that I can call to a diving doctor on call to give a settlement. Maybe it's a doctor with more experience than me. And I can, hey, I have a patient with this in the chamber. What do you think? What should I do? And we have done this in the chamber many times. We just want a second opinion. This is happening. Do you think I'm doing the correct thing? Sometimes we have been in the chamber for 12 hours. I'm tired. I'm doing the correct thing. Yes, just keep doing it. Okay, let's go ahead. And we are not afraid to say that we call for second opinion. This is good.
Yeah, so the bottom line is it's preferable always to call 112.
Yes.
It's I don't want to say it's better to be safe than sorry, but it's always better to overcompensate, but to be extra sure that there's nothing going on. We met with the chief of 112 a couple of days ago, and they promised that they won't get mad if it's not serious. So
You have it here in front of you.
All right. So this is just for your information. This is more what pertains to us. But as soon as you make it to the ER, you're brought into the hospital. There will be a basic ER examination, and based on your clinical history and the history of present illness, everything that's going on, the ER physician, right after consulting us or on par with us, we will decide that if there is actually any other further studies that have to be done before you're taken to the chamber, if indeed you have or have a high likelihood of having decompression illness. So, for example, if it's a pain in the shoulder, that we're suspecting is because of bubbles trapped in the joint, most likely you will be taken to have an X-ray so we can take a look at it. There are instances where we can actually see the pocket of bubbles inside the joint, which is another confirmation of diving sickness. But anyway, all that goes on. You have decompression sickness. You're taken into the hyperbaric chamber where we will do the necessary protocols to treat decompression sickness. Important thing about this is that once the reason why we do all these studies before you're taken to the chamber is because we want to rule out everything else that could be happening. So, say if someone could be having chest pain, or that's also a very good example. Say pain in the shoulder, in their left shoulder, because it's always the left shoulder for some reason. Yeah, it is. I don't know what that's about, but that's usually what it is. But some of you know that pain in the left shoulder could be misunderstood or could be misinterpreted as a heart attack. So to rule that out, we take an ECG just to make sure that there's nothing in the heart that's going on. So that happens in the ER. You're taken to the chamber. We do all the necessary protocols, and the best thing about dive medicine is that treatment in the hyperbaric chamber has, or most of the time, solves everything as you are descending inside the chamber. So as we're putting pressurized air into the chamber, all those bubbles undergo pressure and they become dissolved in the tissues once more. So all the symptoms should resolve pretty much instantaneously. So the key thing, the reason why we're always so adamant about hey, you have to get to the hospital as soon as possible is that resolution of symptoms happens and is successful when it's done in the first hours of the symptoms developing. The more those bubbles stay in the tissues, so stay formed as larger bubbles in the tissues, then they become actually clots. They behave as blood clots, and they're more difficult to dissolve. And there has to be more specialties of medicine involved, etc. So to get the proper response and the most optimal resolution to everything, you have to get to
the more time it passes, the less we can do for the problems. And another thing is that if you just go to Bravo Mataca and you said you have a diving accident without calling 112 or without calling the number, they will call us anyway. So you have 3 ways to reach us in Iceland after a diving emergency. So I put this because the oxygen kits, and I have questions.
You want to stand up?
Yeah, it's okay. It's just about the oxygen kits. We already talked about it, but it's important to have oxygen kit near. It's very good you have in expedition. If we are diving David's Kill, for example, I know in Silfra there is always someone with an oxygen kit around. Am I correct? Otterstad is very near to Reykjavik, so you can just take the car, go to the hospital. If it's very severe, you call 112 and ask for an ambulance. So I don't think we should have oxygen kit for places near Reykjavik with small groups. But for expeditions, it's very good. And I thought this was going to be more questions about, because many people have problems with the supply. Because I know there are some done kits in Iceland and they are not filled by Linde. and this is a conversation we have had with them, and they do not fill cylinders that are not owned by Linde. And these devices, which are like special for divers, are demand valves for oxygen, are not compatible with the Linde cylinders. So do you have this specific type of kits here? No.
No, I don't think so. Just,
Okay.
have you ever used it here?
Yeah.
Many times. But we only have one button, so if one use it, sorry for the other guy.
The other thing with the oxygen is that the oxygen is only a measure for the transport, but it's not meant to just put oxygen. Okay, I don't have to call anyone. No, if you're using oxygen, it's because something happened, and I'm going to put the oxygen until I get more instructions about what to do, or until I get to the hospital, or until the ambulance arrives.
There are two types of oxygen available, industrial and medical.
Yes.
Should we only use medical?
It's preferable.
Oxygen is in both.
Yes.
Really?
Yes.
Yes.
Yeah, that's actually the
I do remember somebody saying that they
Yeah, this is
industrial
the
stuff because it was the same anyway.
No, that's actually very, very important to clarify. From the medical point of view, oxygen, even though it's a gas, it's treated as a medication. So it's like any other medication. It has a dosage, it has a rate of delivery to the body, and it has a specific way in which it has to be delivered to the body. So we can mix both of those. So the ones that are actually cleared for medical use are the ones that we have to go for.
This is a Linde cylinder, which is compatible with the masks, and it works pretty good. We just the same when we dive, so there is no way to look at my presentation. But I know some people here have this kit, and they have problems because they cannot fill it, because Linde is not filling these cylinders. So then I had a proposal in my mind, a solution for this, but I don't need to give a solution for this.
Well, in case we run into somebody who has one of those, what is the solution?
The solution is that they have to fill them themselves. So they will have to rent a big cylinder from Linde and get someone with training, for example, Valdi, who come with a special hose, fill the down cylinder. So yes, I thought that if there are many kits here, maybe with a diving club, you can have one cylinder here, and then you can fill all the cylinders, because this is cheaper than renting this per year. But it's no need for this solution that I had in my mind. So this is very good. And something else to say about this? Yeah, about the grade of the oxygen is different procedures in the filling of the bottle. So the medical oxygen,
every bottle, from medical is tested,
and between each filling they put it onto vacuum. So they remove absolutely everything to avoid cross-contamination of gases. But if you want to use industrial, it's not something I should say.
Every 1,000 baths, every one cylinder of 1,000 baths will be tested instead of each one.
It's like more precise in the quality and the impurities. But if you need to buy medical grade oxygen, I have done it, and I'm very okay to just give you the medical prescription, and you can just buy it with Linde, because we have done it. People from diving centers have required medical oxygen to fill rebreathers, and the people of Linde, they just call me, Leo, I have this guy asking for oxygen.
And they told me, because I was reselling the oxygen.
Yes.
So they went to that. I went for biogas.
Yeah.
Oxygen. That's for food.
For food. This is okay.
And that's the same. But what the thing is now, they're testing every 20.
Yes.
One of the 20 cylinders there, so they know more about the quality.
Yes. There are 4 types of oxygen we can use to breathe: medical oxygen, food grade oxygen, aviator, which is oxygen grade for airplanes. All the oxygen kits in the airplanes, they use this. It's just same oxygen, but with less moisture inside, so it's not freezing without a big pressure difference. And liquid oxygen. So any of these It's okay, but it's no need. You're already getting the filled cylinder. This is just 3 more slides I have here, and I just wanted to put a link because I'm going to share the presentation maybe in Facebook or in the webpage also for you, so you can click and go onto this. But these are oxygen provider courses, and maybe I'm going for the holidays now, but when I come back, maybe we can do another evening, a training of oxygen use of the kit, and we can do this, and we can do a practice and how to use the mask and the flow with the oxygen. And
Because I think only a few people here actually know how to operate it now. Only a handful.
This one?
Yes. People who know how to put this on somebody the right way.
I thought everyone knew because we
Yeah,
have
thank you.
refreshers of emergency procedures. No, it's not the first aid course. We have a refresher that we do every year.
okay.
I missed it if it's using that one.
No, it's not, it hasn't been on using the.
No, it's just been on giving first aid. It's been on using how to use this.
We can do one specific for oxygen, and if you're interested, we can get the certification also through Dan, or I can do this, and I will charge nothing. If you want the certification, you pay the fee of the card. I think it's $10, and you get your certification of oxygen provider. And this is something we can do after I come from vacations. Another useful link from Dan is online resources they have, is how to develop your emergency plan. So this is based for operators or dive professionals. If you're working as an instructor or in a dive center, this link will guide you of how to create your own emergency plan for your own operation. So it has like a checklist online PDF you can fill, and you can create your procedure, and then you can print it and have it in your folder. And the other resource we have from Dan is the HIDA program, which is Hazard Identification and Risk Assessment. So this is a program online also. It's free. You can just log in there and do it. And it will go through a risk assessment program. So do I have oxygen kit? Yes. Do I have this? Yes. Do I have training? So it's like a checklist of safety features that we have to have as a diver professional, as an instructor, or as a dive center. And at the end of this, you get a certification if you comply with this, and it's totally free. And it's not to have the paper in the wall. It's just like a checklist. And oh yeah, maybe we can have this, or we can have this post in the wall with the number of the doctor, for example. This is something that can be in the checklist. And this is the same link, but for diving, for business, for the industry. So this is as a diver, and this is if you're a diving company. So it's different procedures, but it's the same resource. So I will post this in the page so you can have it. And these are the 4 things we want to reinforce today. You should come out of the water the same as you were inside at the beginning. So this is number 1 of today. Number 2, if I need an ambulance after a diving accident, I will call 112. If I do not need an ambulance, but something went wrong, or I have a mild symptom, I should call the dive doctor through Semaboard. And if I'm not sure of what happened, or if it's bad or not, you just assume the worst. And then we start from that to the best. Do you have any questions? Sorry. Yes.
Do you get bored in Iceland? Is it enough for you to do?
We have plenty work every day.
For divers or other?
We have plenty others. Diving accidents, we have around 3 per year, but this year we have had 6, and it's mid of the year. So I think this is the reason of this meeting today. But we have plenty work every day, treatments with patients from vascular surgery, plastic surgery, radiotherapy. We go every day to the chamber.
COVID is over, everyone went for diving, you know.
Yes. Also,
Would you interrupt the other treatments for
Yes.
a diver?
we have a specific procedure. If we get an emergency and we are using the chamber, we have a special procedure for this. This is why it's important to get the call as soon as possible, because maybe you're in Davidsgjá. By the time you come to Reykjavik, we have the chamber ready for your arrival. The picture of the skin. Yes, this was mild. Yes.
Should he have taken oxygen or?
Yes.
He should have. Yeah.
So how likely is it that these symptoms wouldn't have appeared if he had gone on an oxygen right away?
Difficult to answer this because probably they will have appeared also.
Yeah, okay.
Maybe in a lighter way, but then there are no residual symptoms after. The problem is that maybe this diver will have this sensation for many years. And sorry?
We actually took him in, and he saw some improvement after a couple of sessions. But again, as I mentioned, if he had gone right away, there would have been nothing remnant. Now he has a little bit of remnant. So that's precisely what we're trying to avoid.
Would it make difference because